Good morning, afternoon, and evening, depending on where you are from. Today, the talk which I'm going to give is about artificial intelligence in the minds of Indian dermatologists. I'm Dr. Bushra from the Department of Dermatology, MGMCRI from India. Artificial intelligence is defined as the scientific understanding of the mechanism underlying thought and intelligent behavior and their embodiment in machines. The use of AI in medicine has been tried out in various fields, including radiology and pathology. Even though there has been use of AI in the dermatology for the past decade, it is yet to be widely used among dermatologists in India. Recently, the topic of AI has been added to the curriculum of dermatology residency and has been included in the agenda of national and international conferences to create awareness among the practicing consultants. So, this study was carried out with an objective to identify the source of awareness of AI among the Indian dermatologists and to analyze the attitude to AI in clinical practice. The study was a prospective cross-sectional study based on an online survey that was conducted among Indian dermatologists using Google Forms for a period of 1 month. Doctors who have completed or pursuing MD or DMB dermatology in India were included. Those who do not respond to the forms during the study period were excluded. The participants in the study would receive the questionnaire in Google Form through email, and responses within the study period was analyzed. So, in the results, among 1 or 2 participants who responded, residents formed the majority, followed by private practitioners. Many of the respondents belonged to the Tier 2 cities, followed by the metropolitan cities. Majority of the participants had 3 years of experience in the field of dermatology. So, the results were analyzed based on awareness, attitude, perception, and experience. So, under awareness, more than 1/3 of the participants have read scientific literature about AI, but only 15.7% have attended the seminar or conference about AI in healthcare. 1/5 of the respondents had no idea whether they were using AI-based technology in their daily life, while 61.4% responded they were not using it. In attitude, positive attitude towards AI in clinical practice was seen among 61.4% of the responders, followed by 25.3% who had a neutral attitude towards the effect of AI in their clinical practice. The pie chart shows the percentage of people who responded that application of AI in dermatology in diagnosis should be restricted to allopathic medical practitioners, while 43.4% accepted its use should be restricted to dermatologists. If AI-based technology was discordant with a clinical judgment, 50% agreed that they would confirm the diagnosis with investigations. Under perception, most of the dermatologists perceived AI would be useful in dermoscopy, followed by management and tracking of patient records, which is already in vogue in many of the busy clinics. Among the participants, 92% believe that the knowledge of how AI algorithm works at arriving at a diagnosis is needed to trust the decision made by it, that is the black box problem, and almost half of the participants believe that it will reduce the cost of unnecessary investigation. 1/4, 25% agree tertiary institutes would benefit the most by using AI-based technology in clinical practice, while another 1/4 responded remote areas without medical facilities would benefit from it. To build improvised AI algorithms, 62.7% were ready to share patients' data after their consent. In concordance with a recent survey by Gupta et al., 45.8% feared that the advent of AI in clinical practice because of misuse by the patients, followed by 27.7% who feared due to errors in diagnosis and medico-legal liability. The pie chart represented here shows the factors where the study participants feared the advent of AI in clinical practice. In our study, 3/4 of the study participants believed additional training in artificial intelligence is required in residency training, while 59% did not favor the use of AI-based clinical decision apps during residency, which can lead to dependence in clinical practice. So under experience, only 8.4% have actually used AI-based dermatology apps, and 7.2% used clinical decision support apps. So under discussion, though the terms of deep learning, machine learning, and convoluted neural network have been explained in dermatology journals, especially in the recent years, there remains a lacuna of knowledge and use of AI among the dermatologists in India. A Medline search revealed that in the last year, 9 articles were published in India regarding AI in dermatology, out of which 3 articles were from engineering departments and only 1 was a clinical trial from dermatology. In this post-COVID era, when people were forced to rely on technology during pandemic, there has been increased awareness and acceptance of telemedicine and artificial intelligence. A study by Tongdi and Markowitz evaluated rankings for 29 mobile apps in dermatology in iOS platform. 18 were patient-oriented apps and 11 targeted physicians. In our study, only 7.2% agreed that AI-based clinical decision apps should be made available to the public, and majority feared the misuse of the technology by the patients. A recent survey published in PubMed revealed that 48% had a neutral attitude towards incorporating. A recent survey published in PubMed revealed that 48% had a neutral attitude towards incorporating AI in their clinical practice, while the vast majority of our study participants had a positive attitude to it, which is in concordance with an international online survey by Policy et al., who observed less fear of the use of AI in dermatology by their participants. A greater percentage of our study participants feared the advent of AI in clinical practice because of the misuse by the patients, which is in concordance with Gupta et al. Many limitation factors are responsible for the comparatively lesser popularity of AI-based apps in dermatology, such as the need for robust data, especially in skin of color, acceptance by the physicians and patients, legal liability, the black box problem, job threat, and the bias of the programmer. So in conclusion, many Indian dermatologists have a positive attitude towards using AI in clinical practice, but the awareness of AI in healthcare from scientifically reliable or valid sources are lacking. So additional webinars and awareness talks in conferences and teaching programs during residency is needed to create awareness and address misconceptions. Our study is limited by the number of respondents to the survey and minimal participations of the dermatologists working in government sector. These are my references. And I would like to acknowledge Dr. Sharmati Sethumadhavan and Dr. Shrikant Shanmugam for their invaluable support in disseminating the survey form. I have no conflicts of interest to declare, and thank you for your patient listening.